Estheticians here at External Affairs Medical Spa. I've been here for 4 years and I work in the St. Albert location. Okay, so today I'm going to do something a little different and I'm going to tell you about my own personal struggles in dealing with acne and scarring and how External Affairs has helped me achieve the skin that I have today. Okay, so story time. So back when I was in grade 9, I remember I got this huge pimple on my forehead, or as I like to call them, friends. And I was super embarrassed to go to school with it, so I thought I would get rid of it really fast by putting an oxy pad on my forehead. So I took this oxy pad and I folded it in half and I taped it to my forehead with a Band-Aid and left it on all night. And the result was that I had to get bangs the next week because I burnt a half circle scar raised mark into my forehead with this oxy pad. So I had this awful little checkered pattern raised scar on my forehead, which followed me for about 10 years, along with many more scars to come from different methods of trying to get rid of all my friends. So fast forward 4 years with External Affairs, I've done multiple resurfacing treatments. I've had about 4 microneedling treatments with antioxidant infusion. I've had some mixed dose CO2 fractional resurfacing. I've done chemical peels, blue light acne treatments, had a vampire facial, and last but not least, I retired my oxy pads and started with the External Affairs skincare line. So I'll tell you a little bit about what I use personally. Everything is kind of customized to each individual skin, but this is what works for me and this is my routine. Okay, so I start every morning with my cleanser and toner. So I use our 2% salicylic face and body wash cleanser, and then I follow it with our toner, which has salicylic and glycolic acid in it. Then I like to, for the morning, use my green tea serum because it helps with redness and it's mattifying, so it kind of acts as like a primer before I put my makeup on. And following that, I have to use my sunscreen, SPF 36, and it has UVA, UVB in it. So that's my morning routine. At night, I go back and I use my cleanser and toner again. And then I like to use my HA clarifier and my clarifying moisturizer. So the HA clarifier is just really good to help absorb excess oils and it has 12% glycolic acid in it. And the clarifying moisturizer also has 0.5% salicylic in it, which helps to keep everything nice and dry and it's oil free, but still hydrates my skin. And then these are just my 2 little bonus extras. The Resurface Cream is my favorite product. I like to use it a few times a week and it's just a really good exfoliant. It's nice and gritty. I love how my skin feels after I use it. And then I have my spa treatment for when I get friends. So I put a little bit of that on at night and leave it overnight and the inflammation is gone down by the morning. So after I got my skin kind of like cleared up and under control and I got rid of most of the acne, I still had the scarring to deal with. So scarring is a whole different ballgame. It is very delicate. The scar tissue is fibrous and you don't want to over-treat scar tissue when you're trying to do treatments that are safe for the skin and with less risk of side effects. So it does take multiple treatments. It's something that you have to kind of like work with over time. I knew that my scarring was not going to go away overnight and it's taken 4 years and it's still not all gone. So step by step, we're kind of slowly getting rid of it, but the improvement that we have made is huge. So thanks to External Affairs, I'm now able to feel confident in my skin and go out and be happy. So you can see by my before and after pictures how far I've come with my skin. So for anyone else who has skin concerns or questions, it's definitely worth booking a complimentary consultation and coming in and chatting with one of us and seeing what your options are. We'll go through what the best options are for you in clinic and then what you can be using at home to best help your skin.